Hello out there in YouTube land. My name is Luke Gordon. I'm a physical therapist, and today's topic is Piriformis Syndrome. So I've got my visual model here for us. I've got my pelvis, and then my pink kinesio tape here is representing the piriformis muscle. So today I'm going to talk about piriformis, the muscle itself, what is Piriformis Syndrome, and basically how it can cause sciatic nerve pain or sciatica. And a lot of that is going to have to do with the location of the muscle and the function of it. So if we look at your pelvis, this is the pelvis from the back. Hope you can see that okay. You've got your sacrum in the middle there, which is that triangular shaped bone. You've got your two halves of your pelvis on the side. Now your piriformis muscle is essentially starting on the inside of your sacrum. So if you turned your pelvis around, you can see where I've got it stuck, that pink muscle there, or pink tape, excuse me, to the inside of your sacrum. So it's starting from in there, and then it's running towards the outside, deep in your buttocks, out to the outside of your hip. Could have leveled this for you, sorry. So this is your hip out here, and that's your piriformis muscle. So if you were to attempt to locate that on yourself, what you would do basically is, if you wanted to like kind of poke around on your right buttocks there, is just shift your weight to your left leg so that the pressure is off your right buttocks. And then you can feel, the big muscle on top is your gluteus maximus. If you feel a little deeper in there, that's your piriformis muscle. And for a lot of people, it's going to be tender a little bit. And if you have a piriformis muscle syndrome, it's going to be really tender, and potentially you're going to get that sciatic nerve type pain. So let's talk a little bit about why you would have sciatic nerve pain with the piriformis muscle issue. And then I'm going to talk to you about how the muscle gets irritated and things like that. So if you looked at the anatomy of that piriformis muscle, essentially from your pelvis out towards your hip, it was going to the side. So not perfectly to the side, but it's going, left to right or in to out, however you want to think about that. Now, at the same time, anatomically speaking, your sciatic nerve is coming from above that, and it's coming straight down. So it's going this way. So piriformis is going this way. It's like an intersection. Sciatic nerve is going this way. Now, depending on who you are and kind of how you were built, one of two things is going to happen where those things are intersecting. First of all, the first thing that can happen is your sciatic nerve is going to go behind your piriformis muscle, so just deep to it. And then for some people, though, they estimate, 30 to 40%, they're actually going to mix as they go through. So your muscle fibers on the piriformis are going this way, and your nerve fibers for your sciatic nerve are going this way, and your sciatic nerve is basically going to go through your muscle. So hopefully with that in mind, you could understand that if you get an issue with your piriformis muscle, say it gets really tight, or it gets overused one day and it gets inflamed and irritated, and now it's acting up. It's in such close proximity to your sciatic nerve, again, either right on top of it or actually blending where the sciatic nerve is going through it, that any extra tension or inflammation in your piriformis can cause a lot of pain related to the sciatic nerve. So that's your piriformis version of sciatica. Now, I've made other videos. I just made one a couple days ago. Well, I made it today, posted a couple days ago, about sciatica, sciatic nerve pain. What is it? I talked about how most of the time your sciatic nerve pain is coming from issues in your lumbar spine, in your back. But this is one of the exceptions where it's actually coming from that piriformis muscle in your buttocks. Now, if you're wondering which one you have and you think you might have piriformis issue, the dead giveaway for folks with piriformis syndrome is that they will tell you they have a pain in their butt. And I like to make little physical therapy jokes about, oh, is your spouse here? You get it. But anyhow, they'll tell you physically there's a pain in their butt. It hurts for them to push on it. Sometimes it hurts for them to sit on it. If they have a wallet back there, that hurts too. So that's your piriformis syndrome. The reason that it kicks up, and that I think it's an issue for a lot of people, is that it's a small muscle, that piriformis. It's deep to your big muscles like your glutes, which you're going to use for like a deep squat, or you're going to use to do some type of lifting. But this is a smaller muscle way beneath that, and it's a hip rotator. It rotates your hip out when you isolate it. Now, functionally, it's not just, you're not walking around rotating your hip out all day. But that's what it does. It's a small muscle. And so for a lot of people, if they do overdo it, with a hike or an exercise program, or, for my older clients, just going up and down the stairs a few times when their muscles aren't used to it, that relative overuse of the piriformis muscle can really irritate it. And again, you're talking about the muscle tightening up after being used, or just being inflamed and irritated, or a combination of both. So that's how piriformis syndrome kind of comes about, depending on who you are, what your situation is. And anatomically speaking, I hope that makes sense as to why an issue with that little muscle deep in your buttocks could cause significant pain in the sciatic nerve. So that's piriformis syndrome. Coming up soon, I'm going to make a video or two about how to treat piriformis syndrome if that's what you have. So I hope that helped, and make sure leave me a comment or a question below. I'll link a couple other helpful videos right here. And before you go, if you would like the video and subscribe to the channel, I'd greatly appreciate it, and I'll keep putting out more videos. Thanks for watching. I'll see you next time.